Back one more time with Grazel Garcia, and today we're talking about ADHD in marriages, and in particular, how ADHD, how a spouse who is an ADHDer may actually end up burning out. So, Grazel, what does that look like in a partnership and for the ADHDer when they are burnt out?
Um, ADHD burnout or autism burnout is real, right? And if you don't know what that looks like, you may think that it's just laziness or you don't want to do anything, which are really, really detrimental to say about someone who's neurodivergent. Um, Neurodivergent burnout usually the warning signs for that is when there's chronic exhaustion, meaning they're not getting enough support, there's fatigue, and even when they're resting, the fatigue is not quenched by the rest. Um, Emotional dysregulation is another part. It's another warning sign. Executive functioning difficulties when they're piled up, that can lead to burnout. Um, Executive functioning includes cognitive difficulties where it's hard to focus. And then think about it. When you have that every day, all day long, you're gonna burn out at some point. When you're trying and putting so much effort, but your brain is not working, there's gonna be a burnout that's coming in the way. That can also affect communication skills, memory, um, uh, uh, they call it skills atrophy, where you probably knew what you're supposed to do behaviorally to take care of yourself, but then when you're in burnout, the skills that you learned how to do atrophies. You forget because the brain is not working.
Hmm. Okay, so it sounds like someone would reach that stage of burnout because they've been high functioning for too long, or they've been trying to mask their symptoms for too long. Um, how can they avoid hitting that point? I guess that's my next
Yeah.
question.
Great question. Yes, they've been masking um, for a long time. And then they also don't know how to ask for help. There's not enough support for them. So to prevent that from happening, it's really important to know how your ADHD traits is affecting you on a daily basis.
Hmm.
So you might have to sit down and really write down what are the traits of ADHD that are most difficult for me to handle, that affects my daily functioning. If it's time management, then that's one. You need to be able to learn behavioral skills for time management. If it's emotional dysregulation, then you need to learn more, probably meditate more, do mindfulness techniques. If it's impulsivity or emotional intensity or reactivity, then you need to also learn mindfulness techniques and make sure you're pausing. So it's important to know what traits are the most difficult for you so that you can create behavioral modifications, see a therapist, prevent those from happening so that you don't end up burning out. And masking is a big, big, big factor to burnout.
Yeah, and it's quite easy to understand why that would be. If you're in that position where you're masking all the time and you can feel that you're kind of burning out, does that contribute to resentment or kind of feelings of blame towards other people? Like, why should I have to mask?
Um, There's internal resentment probably in a bigger picture when they're masking and they're masking because they're not supposed to act a certain way. Yes, absolutely. That can lead to resentment, and sometimes the once we're in resentment, we can't feel the anger anymore.
Mhm.
So in resentment, usually eh, there's a feeling of hopelessness. And in resentment, it may show up as kind of giving up and not paying attention anymore, not wanting to try. Um, and that can affect other people around you.
Yeah. And I guess obviously we've been speaking about the ADHD spouse so far. How does all of that affect the non-ADHD spouse? Do they start to get this sense of resentment towards the ADHDer? Do they start to get this sense of, I don't know, they're taking it easy, or when they're burnt out, they're just exhausted? How does that play out?
Yeah, I mean, the masking of ADHD definitely affects, everyone around them, especially in romantic relationships. Unfortunately, their non-neurodivergent partner will get affected. Um, is the non-ADHD partner building resentment? Absolutely. They both have resentment towards one another, sadly. But it's because of the cycle, the negative cycle that's been brewing for so long that's not getting attended to. So the non-ADHD partner will see that the ADHD partner may be hyper focusing on something, and the hyper focusing, once an ADHDer is hyper focused, they can forget to do self-care.
Mhm.
They can forget to eat. They can forget to pay attention to shared responsibilities at home. And if they're not paying attention to the shared responsibilities, that's going to impact the non-ADHD partner and the whole family as a unit. So the non-ADHD partner will take on more tasks and responsibilities that's not theirs to begin with, and that will build a lot of resentment.
Mhm.
So burnout, ADHD burnout can be a dangerous thing to the relationship connection.
Yeah. And how can you recognize the burnout as early as possible? How can you recognize, okay, if we keep going down this road, we know where this ends and this is bad, so let's stop it now.
Um, I'll start with the hyper focus. If you're hyper focusing a lot and you're not eating well, then that's a warning sign. When your executive functioning difficulties are the executive functioning difficulties are more present when it's becoming harder to transition from one task to another. That's already hard in the ADHD brain, but if you keep if an ADHDer is going from one task to another, but is not able to actually come back, and that gap is getting more longer, then that's another warning sign. Impulsivity, like being quick to react to normal feedback or neutral feedback by others, is another warning sign. Uh, if you're feeling like you need a lot of support, but there's no support around you, that's a warning sign. Minimizing your own needs. Oh, I don't need help. No one's gonna help me. No one's gonna understand me, so I'm just gonna do this alone. That's another warning sign. And again, masking.
Yeah. Yeah. I mean, there's so many of them, and you can appreciate how difficult it is for both sides of this equation, whether you're the ADHD or the non-ADHD. I'm just curious how that plays out in a therapy session. Are there particular ways that you can help one side see it from the other side's perspective?
You mean when we're talking about neurodivergent burnout?
Yes.
Yes, absolutely. I think the psychoeducation, the therapist has to be well aware and knowledgeable about what autism and ADHD burnout looks like.
Mhm.
So if they're not aware, they're not going to be able to provide psychoeducation to the couple, so that without the psychoeducation, you can understand that this can be easily personalized.
Mhm.
So it's so important that that's there in place in session. And if it's not, something so crucial is being overlooked, and it's not going to help the couple.
Yeah. And I know we've spoken about this quite a lot before about how this neurodiversity, neurodivergent piece of the puzzle is quite often overlooked in therapy, and then that causes quite a lot of damage to the relationship. So it's really important to be aware of it, especially because I mean crazy numbers of people are diagnosed as neurodivergent nowadays anyway. Um, yeah,
Yeah,
it's a really important issue that
it's
needs to be addressed.
crucial.
Yeah.
Yeah, it is really our ethical duty to be able to attend to different neurotypes and different diagnoses, right? Because PTSD um, and neurodivergence can look so similar. So if the therapist is only looking at one, only wearing one lens,
Hmm.
then everything else is getting overlooked.
Yeah. And that could be the one of the missing pieces to really crack that negative cycle open.
Exactly.
Yeah. All right. Well, again, thank you so much for your time, and we'll speak again soon.
Okay. Thanks, Scott.